Well, hello and welcome to everyone joining us here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome back to all of you joining us here. We are talking about our Gold Midwifery Conference 2023. It's coming up very soon here at Gold, and we're very excited. We've been planning this event, of course, for a year. For those of you who have been involved and engaged with our professional advisory committees, you know that it takes about a year to get all these things organized. And we get so excited because we get down to the wire here. February 6th is our kickoff date. So you want to mark that on your calendars right now. And as we begin to talk about this event, of course, we bring in some of our guest speakers who are going to be here with us. And today I'm very excited to introduce to you Sonia Reiter. She is going to be here speaking at the event. So for those of you, again, who want to come in, get to know Sonia, stay tuned. We're going to be introducing you. We're going to be talking about the topic. And you can also head over to our website at any time at goldmidwifery.com. You can register for this event right now, check out all the details, and we'll look forward to seeing you online. So welcome to you, Sonia. It's so good to have you here today.
Thank you so much. It's good to be here.
Yeah, thank you for being part of this program. I know that this is a very busy time in your life, and we appreciate that you've been able to take a little bit of a time out and join us. So first of all, why don't you introduce yourself formally? Let us know what you do and where you are in the world, okay?
Sure. So my name is Sonia Reiter, and I am here in Brooklyn, New York. I am an occupational therapist, and I specialize in pelvic health and pelvic rehab. So I work with pregnant people, with postpartum people, helping them both, during pregnancy as well as afterwards, in getting their bodies functioning and feeling good again.
Absolutely. That's wonderful. Well, hopefully by now people are getting really familiar with pelvic health, why it's important, why we see folks prior to giving birth and postpartum. It used to be for the longest time that you were a bit of an anomaly. We didn't really know how to manage those things. And, but I think it is becoming more mainstream, particularly in the birth field, obviously, because we're very careful about how we take care of our families and particularly, the pelvic floor. But let me ask you, I'm always curious. I mean, my clients often have not heard of, well-being and pelvic health, particularly in the prenatal period, which I find so interesting because this is something, I think it's a little bit newer, probably not to you, but, tell me, who are the people that you're talking to today? And, what is the time that, you're sort of engaging with them and the sort of aha moments that they're having?
Sure. Well, I think we're starting to understand more and more that the pelvic floor can actually have an impact on your birth. So if your pelvic floor is really tight, if it's got a high tone, or if you're just very disconnected from it, it can have a pretty big impact on whether or not you have an easy time giving birth in reality. And I think that more and more feeling connected to our bodies, feeling like we understand sort of what's going on. Can we contract? Can we relax? Right. Can we bulge? Can we bear down? That can make a really pretty big deal. So it's not just about sort of catching the person when there's already dysfunction, when they're already having incontinence, when they're already having pain, when they're already having other kinds of issues, but sort of catching it beforehand and saying, like, do you understand what's going on with this part of your body that no one has ever really talked to you about or helped you to connect to?
Ooh, I loved what you said about connecting. So you're talking about like the emotional side of connecting with your pelvic floor as well.
Yeah, I mean, it's sort of the mind-body connection of feeling like, oh no, there's my baby crying in the background. Sorry about that. I think the babysitter's gonna
That's
take
okay.
him.
That's okay. That's okay.
I have a 4-month-old, so I'm right in the thick of things myself.
Yes.
Feeling, what's going on when you're early postpartum. I'm recording right now, so I think my babysitter didn't even know I was doing this interview. I'm so sorry. But, we're all midwives here. We all work in the perinatal health community.
Absolutely.
This is real life, right?
That it is real life. That's absolutely true. Yeah. So tell me, so I do find this very interesting in terms of how we connect with our bodies, why and how. And I wonder if now, if we talked more in the sense of connecting with our pelvic floor, understanding how it works, that this could actually, it maybe entice people to come in sooner, to have this well-being check, this checkup, or, talk about, even the actionable items. Like you said, you mentioned like bearing down or bulging or all those types of things, because I think these are the things, they're not common language that we're really always really engaging with our clients, maybe if they're lucky enough to be with all of these wonderful midwives, but there are plenty of folks that are in the field that don't always have that connection, or maybe don't even see a midwife until almost later on in their pregnancy. So those conversations could be really good, right, Sonia?
Yeah, I think absolutely. I think anytime someone feels connected to their body, it can make them feel empowered. It can make them feel like sort of not just that they're like along for the ride, but that they're kind of driving the car a little bit more. And obviously birth is unpredictable. We don't know, what is going to happen. We don't know how long it's going to last, what kinds of things might come up. But feeling like I know a bunch of different ways to position my pelvis. I know a bunch of different ways to position my body. I know a bunch of different ways to breathe. Yeah, it's not just about pain management, but also about sort of facilitation of a greater sense of ease, a greater sense of possibility, really.
Sure. So, for your topic, so let's get into your topic a little bit here at Gold Midwifery 2023. So to me, this seems huge. I'm going to read the title: Returning to Sex Postpartum, Expectations, Preparations, Treatments for Pain and Dysfunction. Wow. So you're going to give us a synopsis version of this, I know, in an hour. But I also want to remind folks that Sonia is actually very proficient in this area. She's going to be sending out some emails and stuff so that you can connect with her afterwards in order to learn even more. But tell me a couple of things about this presentation and really why you wanted to share on this topic.
Yeah, absolutely. A lot of times people come into my office and they say, I had my postpartum visit and they said I was cleared for sex, but that sounds like really wild to me. I can't imagine having sex. I'm afraid it's going to hurt, or I did try and it hurt a lot, or I tried and I felt nothing, like I couldn't orgasm. I didn't have positive sensation. Or like, it's weird with my partner right now, or whatever it was. There's so many aspects of sexuality, right? There's the social element, there's the personal, emotional element, there's the fear, the nervous system, but also then there's like biomechanical, like your tissues are different after you've given birth. There may be too much tension. There may be, not enough lubrication. There may be, thinned skin or a scar there, right? So there's just a lot of things to talk about. And in that postpartum visit, like, I know that time is limited and you might just be like, okay, what birth control do you want to be on? And unfortunately, it doesn't serve our clients to have, or our patients to have that be the only conversation about sex. Because people are they want to continue to have sex with their partners. Everything is different. If this is their first time becoming a parent, like all of a sudden, it's not just the two of us, or, whatever their partnership looks like. All of a sudden there's a baby here, but we still want to be maybe connected with each other, or, there's all different kinds of people in the world. So maybe you're a single parent, but you still want to be having sex. There's lots of different ways to be talking about it, but no matter what, people need more support around it, because they are really like, either they had a cesarean section or they had a vaginal birth. And in both cases, sex is going to feel real different. All kinds of sex, penetrative sex, as well as other kinds of sex. So being able to know, what are some ways that I can talk about this with my patients? What are some simple hints that I can give them that might make this process feel easier, feel less scary, so that we can sort of help them, not just when something has gone wrong, as I said before, but help them to prepare to go back into, ooh, I'm gonna try this tonight, and I don't know how to prepare. There's lots of things that we can do, that we can say, like, oh, you can try this, and you can try this, and you can try this, and you can talk about this with your partner, so that people feel more confident and probably are more successful in having a good time.
Excellent. I mean, those are the goals, right? So, but I appreciate you just, being able to validate these conversations, how to get into them, what to ask for, what to listen for, because that's the key thing. What am I hearing? Sometimes these conversations can be really hard, and it's not a simple case of just having sex. There's, like you said, you mentioned so many things. So, that is something I'm looking forward to hearing more about. I think this is a topic, I mean, when you work in the birth field, you talk about this for a long time, however, culturally things change, people change, the dynamics of sex change, all sorts of things have changed, in just sex positivity, and those, that has come to light. So I feel like, we need to keep having these conversations as practitioners. It's important that we're listening to our clients, and we know how to respond. And if needed, they get further help as well beyond, our initial conversations. So yeah, this is going to be a really important topic. Thank you so much. Bringing it to light, returning to sex, postpartum, expectations, preparation, treatments for pain and dysfunction. I will look forward to learning some more from you, Sonia Reiter. Thank you so much for joining me here today.
Thank you so much.
And if you want to listen to Sonia and our other speakers, of course, you can head over to our website at goldmidwifery.com right now to register for this event. It is available and open. Check out all the details. You can check in and see what time zones are available. Join us live. That's the other thing I wanted to mention. Sonia is actually going to be here live with us, which means that you can come in and engage real time, ask questions. We'll have an opportunity. We'll open up the mic for, live Q&A, and I'll be able to ask those questions to her directly. So be there and be part of this movement. It's going to be fantastic. And if you would also like to join us and check out this program, you can come and join us on February 6th. That's actually going to be an open access presentation to all of you with Elizabeth Davis. That will also be live. Now, if you can't make it live, we understand life happens, but know that once you register, you'll always be able to come back and listen to those recordings and connect with us real time also in our forums if you have any follow-up questions. So we'll look forward to seeing many of you there at goldmidwifery.com. Thank you so much once again to Sonia Reiter for being here today, and of course to all of you, our viewers. Bye-bye for now, everyone.